In this video, we discuss the role of exercise in both cancer treatment and prevention. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Physical exercise helps prevent many types of cancer. It also improves quality of life and improves recovery time after cancer treatment. In an analysis of 61 clinical trials of women with all stages of breast cancer, women who participated in exercise had significantly improved quality of life, energy, strength, and had less anxiety, depression, and lower body mass index and waist circumference compared to the non-exercise groups. Another analysis of over 1,000 participants with 7 different types of advanced cancers found that participation in an exercise program during treatment was associated with significantly improved physical function, energy levels, weight, BMI, sleep quality, and overall quality of life. Exercise has also been found to improve recovery from chemotherapy and/or radiation. People who participated in an exercise program post-treatment suffered from less inflammation and cognitive fatigue than those who didn't. But can exercise itself kill cancer? The evidence from randomized, controlled human trials does not currently support that. It appears that although exercise helps relieve symptoms and improve quality of life during and after cancer treatment, it has not been found to significantly extend survival. Yet, we believe that properly designed trials examining the effect of exercise on overall survival during cancer treatment will show a benefit to overall survival. In our opinion, the current trials have either used exercise regimens that were not challenging enough, were implemented for too short an amount of time, or in a population group that was already so advanced, the benefits of exercise were not enough to significantly extend survival. Let's take a look at probably the most rigorous randomized controlled trial of exercise and overall survival against cancer. The study supervised people while they were exercising to ensure compliance, instead of letting people exercise at home and self-report. The volunteers only exercised for 2 hours a week. Actually, it's only 1 hour a week of vigorous exercise if you really break it down. The 2 hours included 30 minutes devoted to stretching and 30 minutes to winding down. The study only lasted 8 weeks. So this is only a grand total of 16 or 8 hours of exercise, depending on which way you slice it, of exercise for the entire duration of the study. Are we surprised that we do not get a significant effect from this? Human trials out of Germany in the late 1970s and mid-1980s, conducted by Dr. Manfred von Ardenne, did find positive survival outcomes when pairing hypothermia, hyperglycemia, exercising with concentrated oxygen, and chemotherapy. Let's take a look at the effects of more vigorous exercise on cancer in animals. The lungs left are from mice injected with melanoma cells that were forced to stay sedentary, while the lungs on the right are from mice that were injected with melanoma cells and allowed to exercise freely on a spinning wheel left in their cages. The below chart shows the intensity of disease, measured as photon count, in mice that were allowed to exercise versus mice that weren't. Another chart from the same experiment shows the difference in caspase-3 positive cells in exercising mice versus sedentary mice. Caspase-3 positive cells are better at fighting cancer. The mice in the above 2 charts ran about 800 meters a day, voluntarily. This is the equivalent of about 5.5 miles for a human. Obviously, people should only exercise the amount that they feel comfortable with, but we would expect to see similarly impressive results in humans if humans exercised the same way the mice did, perhaps even in high-intensity bursts as mice do on the wheel. A meta-analysis of 17 trials concluded that exercise in rodents reduces tumor size. Other animal studies have shown that exercise can more than double the oxygenation of a tumor, which would indicate it could synergize with other anti-cancer treatments such as radiation and/or chemotherapy. Exercising can be difficult, and that undergoing cancer treatment can decrease exercise capacity, but would more rigorous exercise done for longer periods, or even short bursts, not produce a more pronounced result? Let's take a look at the physiological effects of exercise in humans as they relate to cancer. Long-term exercise training reduces lactate production. The lactate, an acid surrounding a tumor, is one of the key factors that keeps therapeutic agents from destroying cancer. Exercise oxygenates tissues. Tumor hypoxia, lack of oxygen, is one of its key defenses. Tumor hypoxia is associated with a worse response to radiation and chemotherapeutic agents. 45 to 60 minutes of vigorous exercise has been found to increase natural killer cell concentrations tenfold and CD8+ T cells approximately 2.5-fold. Exercise increases insulin sensitivity, so the body will not produce too much. There was a point when it was assumed that the leukopenia, a sudden drop in white blood cell count following exercise, was a sign of immunosuppression. Now, it is understood that what was assumed to be a drop in immune cells in the blood post-exercise is caused by immune cells being transported into the peripheral tissues, including the lungs and lymph nodes, areas that frequently develop metastases. So the post-exercise period is not a period of immune suppression, but actually a period of immune activation. With increasingly gentler treatments, such as targeted therapies and immune therapies, patients are able to perform more vigorous activities. Is a more vigorous exercise program not also in store? If there is an ideal time to exercise, it would be either in synergy with other treatments or right after a meal. Moderate exercise, even just walking the dog, has been found to reduce blood sugar spikes to 50% of what they otherwise would be. For more information on the role of exercise during cancer treatment, see the book Cancer Self-Defense 101. Quick tips to help you survive.